So next we have the emergency warfarin reversal concept. So a patient who's on warfarin for recurrent DVT requires an emergency laparotomy for a perforated sigmoid colon. So now what will be your best pre-operative management? So would you be stopping the warfarin with vitamin K and monitoring of the patient? Stop warfarin and monitor every 6 to 8 hours. Continue warfarin. Stop warfarin. Give vitamin K. Monitor with every 6 to 8 hours and give FFPs, or you just postpone the surgery. So, in this scenario, the patient is having an emergency requirement of laparotomy. So, you will stop the warfarin, start the patient on vitamin K, FFPs, and monitor INR every 6 to 8 hours. So, emergency surgery cannot wait for warfarin to wear off. So, we require a rapid reversal technique. So, what are the steps in that? We have to stop the warfarin, give the patient IV vitamin K. Now, the thing about vitamin K is that it requires around 6 to 12 hours to reverse the effects of warfarin. So, for that time duration, we will cover it using fresh frozen plasma, which will contain all the clotting factors and they will immediately be entered into the blood system of that patient. Now, after that, immediately correcting these parameters, we have to check for the INR. It should be checked every 6 to 8 hours to guide further treatment. Now, prothrombin complex concentrate is faster and preferred wherever available. So, what are our key points to remember? That for an emergency warfarin reversal, we have to stop the warfarin, give the vitamin K, FFPs or PCCs, and monitor INR every 6 to 8 hours. So vitamin K alone takes 6 to 12 hours. So for an emergency surgery, FFPs and PCCs are a better option if they are given in the form of isolated options. FFPs and PCC provide immediate clotting factor replacement. However, prothrombin complex concentrate is a better option when available. Now, you cannot postpone the surgery in a life threatening emergency condition such as perforated colon. So, in this scenario, we have vitamin K, we have the FFPs, and we have the PCC. So, for an elective surgery, the best option is giving the patient vitamin K and waiting for its action. For emergency surgeries, we can go with the FFPs or PCC. However, out of these, PCCs are a better option as compared to fresh frozen plasma. So, as in our scenario, we were having all these options, that vitamin K along with FFP. So, we will choose that option for our scenario. But if there is a scenario where there is an isolated option that vitamin K is given, FFPs are given, and PCC is given, then you will choose PCC because they are the best option to select. If prothrombin complex is not available or is not given, then for an emergency surgery, you will choose the FFPs. Then for an elective surgery, you will go with the vitamin K levels.